Welcome to our review on treating cardiovascular disease. So previously we've had a look to see what cardiovascular disease is and what its actual risk factors are. So now we're going to have a look to see what we can do about it if you find yourself at risk of suffering with it. First thing we can do is change your lifestyle. So there are certain lifestyle changes that we can make to reduce your risk of CVD. First one, eat less processed food, because that's going to reduce your salt and your saturated fat intake, and it's also going to reduce your intake of sugar. So all of those are going to reduce the risk of developing cardiovascular disease. Take regular exercise, because as we've said, it strengthens your heart muscle and it also reduces your risk of being obese, which means less risk of obviously developing cardiovascular disease. You can reduce your alcohol consumption, because heavy drinking and especially binge drinking have been linked into increased risk of having a heart attack. And you can stop smoking, because as we've said, smoking is a major risk factor for atherosclerosis and heart attack. So cutting out the smoking severely reduces your risk of developing CVD. The second step we could take to treat cardiovascular disease is through the use of medications. So this would be in addition to lifestyle changes. It's not just a case of pop a couple of pills and problem solved. You need to combine that with the lifestyle changes we've already discussed. So there are 4 types of drug that we tend to use for cardiovascular disease. The first one, probably the most common one, the statins. These reduce blood cholesterol by preventing it being formed in the first place. The downside is that when you take statins, you can also suffer with an upset stomach. Antiplatelets are going to actually reduce the stickiness of the platelets, so there's less risk of blood clotting. Downside being, if blood's less likely to clot, you could also suffer with internal bleeding. Beta blockers actually block the effects of adrenaline, so your heart rate is slowed and blood flow is improved. The downside, you can suffer with dizziness and tiredness. And then the last one, the nitrates, these work by actually widening blood vessels, by relaxing the actual muscles in the walls, so that means more blood can flow through at a lower pressure. Again, we've got the downside of dizziness, but also with headaches in this case. If the medication and the lifestyle changes aren't sufficient, then we do have the option of types of surgery as well. One type of surgery we could do is a valve replacement. So this could actually allow us to change out a valve that's become damaged by infection or as the result of age. So if we've got a faulty valve in our heart, then blood is flowing backwards. So that can lead to heart failure because not enough oxygenated blood is reaching the heart muscle. So we'd swap out the faulty valve for a different one. We could carry out a procedure called an angioplasty, which is where we insert a stent into a partially blocked artery and then it opens them up and widens them, allowing the blood to flow through once more. We could carry out a coronary bypass, which is where you've got blocked coronary arteries, which are the ones that supply your heart itself. So we take a blood vessel from somewhere else in the body and then we basically create a little route round the blockage. If all else fails, the last resort is a heart transplant, which obviously isn't a great solution because hearts, you can't just get one from someone who's still alive, and it takes a long time to actually find a suitable donor, and a lot of people unfortunately will die while waiting for that heart transplant. So it's far better to obviously take into consideration your lifestyle changes to actually avoid getting to the point of needing a heart transplant if at all possible. Hopefully at the end of this video you can describe some lifestyle changes, some medical techniques and some surgical treatments for cardiovascular disease, and you can also evaluate those different treatments that are available.